Welcome to Dr. Gor Show. Freezing of fat? Is this really working? That's usually the question I get from patients when I bring up this new revolutionary technology. It's a very simple, FDA approved procedure to freeze the fat cells. This is a fat reducing procedure. It's clinically proven. There's no downtime, there's no incisions, and there's no blood loss. So how does that work? So today's topic is freezing of fat, and I'm going to talk about this revolutionary FDA approved technology which is used worldwide, and it's called Cool Sculpt. As the name suggests, cool means cooling, sculpt means sculpting and taking care of the fat. This technology has been approved by FDA. There is this machines that are used to freezing the fat cells. As you can see on this slide, that this procedure is FDA approved and clinically proven and has won lots of awards. How does this work? So as you can see on the next slide, these are the cells that when we eat fatty food, it goes through the stomach, fat gets absorbed, it reaches the fat cells, and the fat cells then starts growing and growing and growing. This technology, which is freezing technology, kind of shrinks these fat cells. So as you can see in the next slide, how this works. So first it kind of makes this cells smaller, and then it freezes them, and then it dies down, and then within few weeks it gets absorbed from the body and is either excreted in the stools or in the urine. So as this slide depicts, these are the 4 stages of fat freezing. Now, procedure itself is very easy to do. It's in the office, and before anything else, we have to select the right patients. So this is not a weight loss program. This is not something that you're going to lose 20-30 pounds. It's contouring, it's making the shape look better. So it works in a very, very small areas in a very effective way with the better results. These are the areas that you cannot kind of work out. Even if you do a lot of diet and exercise, these are the very difficult areas to lose fat from. So that's why this mechanism works much better for those areas. So what are those areas? So let's go through that. So we are talking about those small areas where it works the best. So as you can see on the slide, that it works really, really nicely on the love handles, as we call the side areas of the body. Outer part of the thighs, lower abdomen, side of the stomach. You can see very nicely it works on the side areas. As you can see, it works on the lower abdomen, outer thighs, inner thighs. These are the areas which are very difficult to burn. Also, it works very well on the back side, below the rib cage, just below the armpits. These are the areas which are very difficult to lose. Also, if you can see, this is how we target the side areas, the lower belly, especially women after giving childbirth. You see the fat in this area is very difficult to lose. So how do we go around? So as I said, first patient selection is very important. You select the right kind of patient. You have a right kind of expectation that you're not going to lose 50 pounds or something. This is fat freezing. This is sculpting. This is to look better, to shape better. After that, consultation is done. Pictures are taken, and we tell which areas we are going to target. After that, the person comes in for a treatment. When the person is coming for treatment, the treatment takes an hour to hour and a half, depending upon which area we're going to target. So we make sure the patient has some reading material, or we have computers to do their work while they are getting treated. It's a really, really painless treatment. And we are looking at the areas which needs to be treated. So as you can see, this is the lower area which is to be treated. So the two gel pads are attached on the areas which needs to be treated. So depending upon, either we can do the lower abdomen, or if we want to do the shaping to the side and on the top. These are the difficult areas to be treated, right? Because even if you do exercise, it's very hard to lose fat in this area. So we put two pads on that two areas of treatment, and we freeze the cells. So this is how the areas are selected, and these are the results that we get. Once a patient is comfortably placed, we mark the areas with a marking pen. As you can see on the slide, that the area has been marked. After the marking is done, we kind of hold that area where there is a layer of kind of cooling gel is applied, so you don't feel that freezing, you don't feel that frostbite kind of a feeling. And then that area is put into the suction gel and it's held inside. Once the suction is applied, it doesn't move. So we leave it in that area for an hour while the freezing cycle is happening. Our aim will be to make sure the person who is getting treated is very comfortably placed and is doing material. Anytime if there is any concern, any pain, then there is a call bell or a pager left with that person to call. This is the basic treatment areas and how the technology works. These are the different kinds of probes that are available. There is a Cool Core probe, there is a Cool Curve probe, there is a Cool Fit, Cool Max, and Cool Smooth, as you can see. Depending upon which area it has to be applied, we select the shape and the size. Depending upon the size of the patient, we are selecting these probes. As you can see here, the pinching of the skin is done and the fat is taken in. Freezing is done. The person is very comfortably placed. As you can see, the treatment area has gone inside the vacuum aspirator and the cooling panel is doing its job. Some areas will look better if person is standing, because then we can see the side areas, the back of the thighs, where it's kind of the fat is folding out. So sometimes we might have to put the probe in a standing position and then get the patient comfortable. As I was talking about the double chin, it's a very easy to treat area, and we place the probe just as the slide shows under the chin area. And as you can see, the results are amazing. Usually the best results are seen after 2 to 3 months, where complete freezing and shrinkage has happened and the cells have kind of eliminated by the immunity of the person and got reabsorbed. As you can see on this slide, the stomach, especially that pouch that's so difficult to treat, can be really gone either by 2 cycles of 2 large areas or 2 side areas. And this can take up to 6 months to see the final results. As I said, this is not a weight loss thing, so one does have to be careful what they are eating and continue with the exercise pattern. As you can see, this is the lower area that I was talking about, very, very difficult to treat. Just above, especially with Indian kind of dressing, when you're wearing sari or a blouse, you can see that layer of fat just folding just below your blouse line. And these are the areas which are very difficult to treat. As you can see on this slide, the outer thigh and the lower part of the buttocks, which is very hard. And that kind of helps lift up, because when you take that extra fold and from the side, it definitely helps to look better. This can be used even in men, because why should we leave men out of this technology? So especially if they have the fat around the abdomen, behind, and just below the buttocks, that works as well. Double chin, a lot of men have double chin, that kind of helps with usage of that. The results take the best if you take 2 treatment. So the first treatment takes an hour, and after 4 to 6 weeks, one can come back for the second treatment, and the ideal results are seen within 4 to 6 months. So this is the best time to get things done before the summer starts. Like if you want any of the small problem areas to work upon, this is the time to come. As you can see, my number is on the screen. You can either visit my website, or you can call my office to make a consultation. We do have some special programming. This is not covered by insurance. We do have credit card payment plans available. The treatment is available only by physician. This is not something you can go to a nail parlor. This is not to be done by anybody else except physician. So this is something you have to know how much pressure, where to put, how much freezing is allowed, if there are any other comorbidities that we have to watch for. So it's better to be done by physician, and that's how it's been only done by physicians. As I said, that after the suction is done and freezing is done, once the cycle is over, then it's taken out. There is a cooling gel applied again. The area has to be massaged. That way the whole fat gets redistributed. It does feel a little bit stiff. It does feel a little bit tight, and it can give you some tingling pain. Usually just putting any lotion and just massaging that area helps, and in 6 to 8 weeks you'll see some shrinkage happening. We'll take a short break and we'll be right back. Welcome back to Dr. Gor Show. So far we've talked about cool sculpting. In synopsis, this is a freezing material where sculpting of the body is done to get rid of the extra fat around the waistline, just below the belly button area, like an abdominal patch or a pouch as we call it, love handles, fat around the armpits, double chin. It works really good by freezing the cells. There is no cutting, there is no bleeding, there is no downtime. This can be done very easily in few hours in doctor's office with the right kind of consultation, right kind of physician doing it, and expectations. Now we're going to show you a short video where it explains how the procedure is done and where it can be done and what to expect and when to expect the results. This video will kind of explain the procedure in a very simple way.
Mirrors. They show us all our problem areas. Those places that we can't wish or squish away. Well, now, fear no mirror and eliminate those problem areas with Cool Sculpting. The patented cooling technology targets and kills fat cells with no surgery or downtime.
After getting the Cool Sculpting procedure, it gave me back the body I had before I had kids. I feel much more confident.
I don't have to think about what I wear and how it's going to make me feel anymore. I know everything I put on is going to make me feel good. And that's a new feeling.
It's as easy as getting a pedicure. It's that easy. Just makes you feel kind of a little bit more like, I can do this. I can do this.
And with the Cool Sculpting procedure, you can do it too.
Welcome back to Dr. Gor Show. So far we've spoken about fat freezing, and now to go to another kind of cosmetic but really therapeutic treatment for women is lasers in GYN, lasers for urinary incontinence, and that is Femilift. Femilift is a name of the company which produces the laser, and it's a carbon dioxide laser. There are different kinds of laser depending upon the wavelength. They can be argon and Nd:YAG, but carbon dioxide laser is the one which we use in the vaginal area, especially urinary incontinence. What does that mean? Urinary incontinence is when you cough, when you jump, when you are doing something strenuous. There's an involuntary loss of urine in the way of few drops. Sometimes it can be embarrassing. It interferes with your lot of activities. If you are dancing, active, tennis player, or you want to play with your grandkids, anything like that can affect your life. So that's urinary incontinence, and the treatment for that we have is through lasers now. That's another revolutionary technology we have in gynecological field. So that's as per the slide, as you can read, it's an FDA approved carbon dioxide laser treatment. It not only helps with the urinary incontinence, but it definitely helps with vaginal atrophy and dryness. So what do we do when somebody has a complete incontinence, that when they are doing these activities, they are losing some drops of urine? So first we, as usual, take a detailed history, when and how much amount, what activities, do they have any other symptoms like prolapse, Do they have any urgency? That means they have to go, they can't hold it, and then they have involuntary loss of urine just before reaching the bathroom. So that's called urge incontinence. You can have a prolapse related incontinence. Lasers in GYN are specific to gynecological causes of stress urinary incontinence, where the angle of the urethra is moving, it's not stable, and that's why there is incontinence when there is increased abdominal pressure. That's why the laser works better, because it lifts the vaginal area and it kind of attaches the urethra and the sphincter back into intra-abdominal area. So that's kind of like a nutshell of the thing. So yes, it can be used as per the slide, as you can see, vaginal atrophy, that means vaginal dryness, less elasticity, and incontinence. I usually tell my patients that this is similar to what we call as facelift, right? Like when you do a facelift, when there is a laxity of the skin on the face, when you do laser, it kind of lifts your skin. That's because of the collagen. And that's how it works. The symptoms of vaginal atrophy is vaginal dryness, burning, irritation, less lubrication, painful intercourse, some bleeding. So that's why we give this kind of a treatment for these patients in the terms of lasers. So as I was explaining earlier, this is a facelift for vagina. As we do for the face, with the laser, there is a tightness of the collagen. It lifts the skin up as the collagen tightens, and it makes everything up. Similar in the lasers, when we use, it kind of makes the collagen in the vaginal area very tight, and it lifts the vaginal area. It increases the secretions. As you can see, the atrophy, which is the dryness, because it lifts, it makes the tissue very supple, and laser definitely helps, along with using the creams and hormones, etc. Different things about the causes of incontinence and how we can use this lasers for incontinence. This is called the epidermis, and this is called the dermis. This is where the effect of the collagen, of the elastin is there. And as you can see, when the collagen is inside after the carbon dioxide treatment, it makes it tight, it lifts everything up. So this is what the area of treatment is going to be with the lasers. So how does it help? Initially, after treating the area with the laser, there is similar to the other procedure, there is no cuts, there is no downtime. This actually is quick, less than 5-minute procedure. I call it as a lunch time appointment. Somebody comes in during their lunch break. Of course, this person has been completely worked up. We've ruled out any infection, pregnancy, any other causes of any bleeding, any cancers, normal pap smears. A right candidate who has some sort of dryness, some sort of elasticity issue, and stress incontinence, not a mixed incontinence, then this is the right candidate for this treatment. They walk in, the procedure is done, and in 10 minutes they are on their way back to either work or home. So it's a very, very revolutionary technology which works on the basis of laser and collagen. So initially there is some sort of edema, irritation, then there's a shrinkage, as I said, of collagen, and then there's a new fibroblastic tissue which comes, as you can see on the slide, and that new collagen makes it much more supple, much more elastic, and it's a very safe procedure. This is also an FDA approved procedure. As you can see, this is the probe which goes inside. This is where the laser beam is introduced. So the objective, as we discussed, is dryness and stress incontinence. As you can see, this is the healthy tissue and this is intentionally wounded tissue. So these are the laser marking when we do with the Alma laser. These are the areas which are treated. And this, when it heals, you can see these are the small areas of laser treatment. In 1 second, it's delivering 9 by 9 dots per 1 centimeter square. As I said, there's no downtime. It's a very accurate treatment. We've ruled out any infection, any cancer, any pregnancy. So we do 2 to 3 passes for an entire canal, usually a month interval. 3 are usually sessions which are needed, but I've seen great results even with 1 or 2 settings. As you can see, the probe is introduced. We start at the level of the urethral junction. We go as far as possible, and then the laser beam is gone. 78% of patients say their stress incontinence is improved. That's a really, really high number compared to the other traditional treatment. We used to put like a sling. That used to be a foreign body inside. There is a risk of infection, there is a risk of bleeding, it's a procedure, there is anesthesia, and also erosions. Like if you see TV after midnight, you'll see lots and lots of cases of erosion. That mesh erodes the vaginal tissue. But that was the only treatment available. Now we have this revolutionary technology with 88% improvement without any cut. So it really works in the right kind of patient. Most patients, when they come, they have these questions about how are they going to feel? Are they going to feel immediately? My answer to them is, there's no downtime, but give it a 24 hours for your body, that edema, irritation to kind of get better. It takes minimum 4 to 6 weeks to see the results. To discuss this further, you can always approach me. You have my number and my website. So today we've talked about 2 important technology which is available: fat freezing and lasers for urinary incontinence. There are informative slides on this show as well as some videos. Please watch them. This show will be available on YouTube, on Dr. Gor's YouTube. Thank you for watching. Till next time. Goodbye.